Hello, welcome back. Chronic constipation and its effects on our body. That's the topic today we are going to discuss. Constipation, for practical reasons, passing less than 3 times motion a week is called constipation. Or in the previous video, the scientific explanation is dry motion, cylinder-like motion, passing incomplete motion, feel like passing again and again motion, or putting 25% of the time some effort to pass motion. These are the scientific definitions of constipation. Okay, what is chronic constipation? If the constipation is more than 3 to 6 months, it's called chronic constipation, and its effects on our body is, of course, if you don't pass motion a day, you feel very uneasy, discomfort, feeling bloated, irritated, breathing difficulty. These are the simple effects of constipation. But what are the diseases that can happen? First is piles. So when you put pressure on the dry motion, the rectal veins, they enlarge, they swell, and there's a piles. It can even bleed. And next is the fissure. Fissure is nothing but some tissue damage or like cut. They're like mouth ulcer. They are like cut in the rectum because of the dry motion. This is the second one. Third one, fecal impaction. These are very difficult one to treat because when the motion water is completely absorbed and it becomes like a solidified like a cement rock, then it can even obstruct the intestine. It may sometimes require surgical treatment. And the next is rectal prolapse. The extremes of age, young age or old people, when they have a chronic constipation, when they put pressure, the muscles they get weaker and the rectum they can prolapse out, and this also may require a surgical treatment. The next is very important thing is hernia. So hernia, especially inguinal hernia or even incisional hernia, this hernia that happens after any open surgery. Incisional hernia, they can happen because of your chronic constipation. And the very important, these things, whatever we said, these are all they are diseases, but they won't endanger your life. But if you have a heart disease or a heart attack, suppose you have a constipation and you're putting pressure, it's a chronic constipation and you're putting every day some pressure, it can compromise the blood supply to the heart and even cause heart attack and death. So avoid constipation and as much as possible. And if you have any diseases, and you should take consult a doctor and try to take laxatives, and you can reduce the effects of constipation on your health. Thank you.